It's River to River from IPR News. I'm Ben Kiefer. Well, let's get into our time travel machine and think back just a few years. It really wasn't that long ago when schools handed out laptops and tablets, and a lot of parents, myself included, assumed that was progress. More tools, better learning. That was the promise. But something happened. Parents started noticing their kids coming home from school having watched YouTube or stuck in an app loop for weeks, unable to move forward, or in a classroom where every child had headphones on and a screen in front of them, and the teacher was, well, somewhere behind it all, I guess. Of course, the teachers were there. A fourth grade class in Los Angeles was assigned to use an AI app to draw the fictional character Pippi Longstocking. The app generated sexualized images. Perhaps you read that article as well. That's the kind of thing that turns a skeptic into an activist. Now, across the country and right here in our state of Iowa, parents, pediatricians, and educators are asking hard questions about how much technology belongs in the classroom and at what age and under what conditions. Iowa's new MAHA law was signed last month, will limit digital instruction to 1 hour a day for kids in kindergarten through fifth grade starting July 1st. Today, in the first part of our program, 3 perspectives on what's happening, what the research actually says, and what a thoughtful classroom might look like going forward. Emily Hooley is an Iowa City parent of a third grader and a kindergartner, also a former teacher. She now substitutes as a teacher. She has been one of the parents in her neighborhood working to limit screen time at home and school. She joins me in the studio today. Emily, welcome.
Thanks, Ben. Thanks for having me.
Alongside Emily, Dr. Paget Skogman. She is a Cedar Rapids-based traveling pediatrician and a physician ambassador on excellence for social media and youth mental health. That sounds exactly like what we need today, Dr. Skogman. Welcome to you.
Thank you. We hope so. I'm also a mom of 3 littles, too. So.
Oh, that is important in this conversation.
It is.
I want to start with you, Emily. What was the moment, the article, the conversation, the thing that you saw perhaps in your own kids that made you think something's wrong here?
Mm-hmm. So thankfully, I didn't see anything in my own kids to begin with, but I did last summer read Anxious Generation by Jonathan Haidt, along with a friend and neighbor and fellow parent. And I was kind of appalled at what could happen if our children continued to use smartphones and social media specifically. And so we worked as a neighborhood group to have families sign on to the 4 reforms that he talks about in his book. The collective reforms to work against the screen time and social media problems.
What were the biggest problems in Jonathan Haidt's Anxious Generation that scared you the most?
Yeah, so thinking about kids being unleashed online with no guardrails was probably the scariest thing for me. Mm-hmm. And knowing that no matter how good our intentions are as parents and teachers, kids will come across content if we are allowing them to get on the internet. Without teaching them first some critical thinking.
Mm-hmm. When you started these conversations in your neighborhood or other places in your school area, neighborhood, what did you find when those conversations started up? You had a lot in common with the other. Was there a mix, or was it like, yeah, we got to do something here?
As most of the families are elementary school families, and so I was surprised at how many people felt the same way. So we have 20 families now in our neighborhood group who are signing on to these reforms. So not a lot of pushback in our neighborhood.
Mm-hmm. Okay. Dr. Skogman, I think you were already seeing something in your practice when you read this Jonathan Haidt article, weren't you?
Yeah. So I started as a pediatrician out on my own in 2018, and kind of immediately in private practice was overwhelmed by the amount of anxiety and depression visits I was having on my panel, and felt almost underprepared because in my residency training, it didn't feel like we had seen kind of that much. And so we were dealing with it, and I'm very comfortable with mental health kind of because of my own past and some of the things that we'd been trained in. But as it evolved, I was like, gosh, it just doesn't make sense. Is this just Cedar Rapids? Is this everywhere, So then more and more data was coming out. And then it actually was when I also read, it was an article in The Atlantic by Jonathan Haidt in March of 24. And it's obviously correlative data, right? So he looks at everything and says kind of 2012 is when smartphones became ubiquitous. And here's what happened to anxiety rates. Here's what happened to depression rates. Here's what happened to suicide attempts. Here's what happened to actual suicide. And looking at that data, I was like, oh, we have to talk about this, right?
Not scientific causation, but a heck of a lot of correlation.
A lot of correlation. And in the book, he actually dives into like, okay, but what if the parents are spending less time parenting and they're not? And what if it was the Affordable Care Act? And what if it's, all that sort of thing? So anyway, with that, we also kind of had this group of moms that I was talking about. And my plan had always been to like delay my own kids' smartphones and iPads and things like that. And then as my own kids got into school, were using their own iPads, right? Had exposure to YouTube. My kid last year Googled, is Santa Claus real? In her classroom setting. They're getting and I was like, oh my, what is happening? Yeah. And then I'd walk in and see them. And then the whole class of kindergartners has their headphones on their iPad. And they're like independently learning, which in and of itself doesn't sound concerning, but really of the school curricula, right, that we teach them, 40% is the actual curriculum where they're learning like math and science. There's a 60% time of the day that's a hidden curriculum about socialization and learning sustained attention and interacting with other peers and playing puzzles and teaching each other. And with this ed tech, it's not happening. Yeah. So I started kind of lecturing and have actually a social media account devoted to this, which is hilarious because I hate social media. But kind of looking at all of this to say like, okay, like it's actually starting, I think Haidt's book kind of addressed smartphones and social media, right? Which is an older kid problem. My argument as a pediatrician, I think a lot of parents feel it actually starts much younger with the iPad and parents handing over their iPhones and some of what's happening at school. So it's actually kind of this multifaceted problem that we're all recognizing.
So you have like a 3 or 4 year old and you hand over the iPad to babysit, so to speak.
Kind of, yeah. Which as pediatricians, we recognize like sometimes occasionally is necessary, right? But what we know about kids and their brain development is that if you actually hand them instead a stack of blocks and put them in a contained space, they're going to learn more with just a simple stack of blocks than they are watching a screen all day, every day, that kind of
even
sensory
if they can
input.
Interact with that screen.
Correct. Even if it's interactive, it's not doing what we think it is. So,
Dr. Skogelman, we're packing a lot into this short conversation, but I wanted to get this facet in there because you cite kids, as a pediatrician, kids with ADHD as disproportionately affected by fast-moving images on screen. That's a clinical observation. Say more about that.
Yeah, so there's this really insanely cool study called the ABCD cohort, which is run over the last 10 years, and we've gathered a ton of data, looked at functional brain MRIs, and then been able to discern, like, okay, how much screen time are they getting? What's that doing? Different things like that. The way the brain works with ADHD is it's much, much more visually stimulated. Right? So these kids take in a lot of images and things like that, which screens are a lot more visually stimulating than a chalkboard or a piece of paper, right?
Sure.
So that lights up different parts of their brain, right? But then also makes it harder for them in some ways to be learning and obtaining the information, right? They're visually stimulated, they're engaged, but not necessarily to the right thing. The other piece we know of the brain, and this is for all kids, not just ADHD, but we learn contextually, right? So if you're teaching a kid vocab words outside of a screen environment, they're much more likely to be able to retain and recall those vocab words in real life. If you're teaching them in a screen environment, the brain kind of holds that in one spot. So when you try to get them on the playground to recall a vocab word, their brain can't kind of pull from that because it's in a screen-specific context. So it's not just kids with ADHD, but especially if your kid has ADHD, it's a thing to really look for and be discussing with your school and IEP to try to back them off a little bit of screens.
Jonathan Haidt laid out 4 rules: no smartphones before high school, no social media before 16, more unsupervised play, phone-free schools. And Emily, back to your household, your neighborhood, your school, neighborhood school. You've tried to implement these as other parents have that you got together with. I understand your household has essentially no recreational screen time?
Just occasional movie nights.
Okay.
Will do.
Walk me through how that actually, because some parents may be going, what? How does that work? How does it work day to day with a third grader and a kindergartner?
Well, we have a big recycling box, and they dig through that to create things.
Recycling box to make things, crafts
Yes.
and stuff.
Yeah, they're just busy, busy, busy when they're not sitting there staring at a screen.
Yeah. And how do you handle that? Are they excluded at school from others because they don't have the devices? I mean, my kids are all adults, but when they were growing up, it was like, they're going to talk to me every day. It was like, I don't have a smartphone yet. I don't have a smartphone.
I'm totally in that world. Have your kids pulled that on you yet?
Oh, no. And I think it's because so many of
Your
our
friends
neighbors
are-
and friends,
yeah.
we sort of got out ahead of
That's
of
awesome.
this. And no one is saying, well, but so-and-so has a phone. I need a phone, or otherwise I'm missing out. It's like
Yeah.
the rare kid who has a phone.
So mine's
Really?
the opposite. In
Yeah.
our school, my fourth grader, all her friends have iPads. She doesn't. And so they text each other at night. But often they'll text my phone, and she's outside playing with other kids.
So how do you handle that when that's mixed? Now, Emily, I'm going
Yeah.
to say you did a lot of forward organization, so you've got it easier.
Yeah.
Dr. Skogman.
I'm always backpedaling over here. I'm like doing the best I can, but every year I'm peeling back something that I should have done the year before. I'm a
now
very
you've got
real parent.
you've got the tougher job. So
Yeah.
what if it's mixed? What if there is that peer pressure and hey, you don't have a
Oh, there's so much peer pressure. We're trying to navigate it every day. So I let her sometimes use my phone to contact friends that are doing that. I try to coordinate a little bit more play dates. And then ultimately I try to get her just outside as much as I can in our neighborhood. Because if she's busy playing with other kids, she doesn't necessarily miss it. And I do feel like her friends that have iPads spend more time in their house texting each other, where she's outside more on her bike, on her trampoline, getting into all sorts of trouble that she can. But it is a very tricky parent thing to navigate. I will say, as a parent and a pediatrician, anytime I peeled back screens at our house, right, we used to watch TV during the week. We don't as much anymore. There's always about a 2-week transition period where the kids
they
throw
get
a
mad.
fit.
They get mad.
They have no idea what to do with their time. They're whining the whole time. You're like, it feels like their ankle biters just all over you. And then all of a sudden, they're playing Legos and reading books in their room. And you're like, wait, what's happening? I mean, my kids read probably threefold what they did when we cut back their screen time. And their reading scores have improved. Their vocab's gone up.
amazing.
But it naturally happened. I didn't have to force it.
We have to take a short break.
Yeah.
Dr. Paget Skogman, a Cedar Rapids-based traveling pediatrician, obviously with a lot of opinions on our topic today. A lot of important information, expertise. Emily Hooley, an Iowa City parent, a former teacher. When we come back, we'll hear from an educator at the University of Northern Iowa with a different perspective. Technology in schools. Where are we? Where should we go? We'll be back in just a moment with more River to River from IPR News. Back with more River to River from IPR News. I'm Ben Kiefer. Today talking about technology in schools. Who should have it? How much? Who gets to decide? With me, Emily Hooley, an Iowa City parent, former teacher, now substitute teacher. She's part of organizing her neighborhood school area to get rid of a lot of the technology in the schools. Dr. Paget Skogman, a pediatrician and physician ambassador on youth, mental health, and social media, also in the studio here with me. Now in our Cedar Falls studio, Katie Nedwick is with us. Katie is coordinator of the Teach Studio at the University of Northern Iowa. That's where pre-service teachers learn how to use educational technology in the classroom. Katie, welcome to our lively discussion.
Thank you so much for having me.
You've been listening to Emily and Dr. Skogman. I want to give you a chance to describe what you do, and then I'll ask you about your reaction to what you've heard from these two with me in the studio in Iowa City. What do you do?
Yeah. I am the coordinator for the Teach Studio space, like you said, and it is a collaboration between the Rod Library and the College of Education. And so we are part of the Rod Library, but we're located in the College of Education building. And we serve everyone on campus, but primarily we serve the education majors. Mm-hmm. In our space, we have children's literature, so we have books, and we have manipulatives that they can use in their field experience, so like educational board games and flashcards and things like that. And then a big piece of it, we also have educational technology, which they can experience in our space or they can check out and use with the students that they work with.
Yeah. Okay. So what did you hear in the conversation we had with Dr. Skogman and Emily there? Did you feel that they were right on the mark, or did the pendulum swing a little bit too far for your liking?
Well, I also read Anxious Generation. I am a librarian, so
All right.
I do read lots of books, and I did read that book as well. I'm also a parent, and so I am also very interested in this conversation. I think a lot of what they were speaking to, with the cell phones and social media and things like that, they also talked a little bit about iPads with screens. The things that we have in our space start out without screens. We have a lot of things that are dealing with very, very basic beginning computer coding, and then goes up into later on when the kids are a bit older, like upper elementary school, maybe they would be getting into something that would have a screen. But we kind of have a mix of both things.
Yeah,
in
and I
our
understand
space.
something you have there is called a codapillar, a mouse, a mouse there. This
Yeah.
is without a screen, a codapillar. What is a
Yeah,
codapillar?
it's made. Yeah, it's made by Fisher Price, and it looks like a caterpillar, and it has little sections that you just snap together. And because it's made for Fisher, it's Fisher Price, so it's little kids, and you snap the pieces together, and it's just to kind of start the coding sequencing that you would need for computer coding. And so little kids can do it. My 3-year-old was doing it when she was 2. You just snap the pieces together, you hit a button, and then it will go whatever direction depending on the way you have the pieces snapped together.
Why is that better for young people than a box of recycled materials to build crafts out of, or blocks?
Stacking blocks.
Yeah. Why
I
do we
don't
need
know.
a codapillar? Sorry.
Yeah. I think it's not this or that. I think it's an and situation, personally, in my opinion. I think that there could be room for all of it, and I think that there needs to be a balance. What I have seen with the technology that we have is that it helps students with their creative problem solving, which they can get with other things as well. But we do live in a technological world.
We do.
And so they do need to have some skills going forward. And I think what's good about the ed tech that we have is that it can provide some educational learning with learning some of those technology skills that will just help them as they go forward. And it's good collaborative work. I know that they had talked about that before, about working together. In my situations, I would like to see the kids together and they are having conversations and they're trying to figure out why didn't that go the way it was supposed to go, and
Yes.
problem solving together in a group.
Yeah.
Okay. So in a word, it's not technology bad, blocks and
No.
recycled
Sure.
materials good.
Yeah.
It's let's figure out how we use both of these things. Emily Hooley, you're the Iowa City parent, and you've been on the forefront activism here. We had a good point there, Katie. You don't want to. You must have had this. You don't want to disadvantage your kids in what is going to be a unless we have some kind of. Okay, I don't want to think about the scenario that takes all the technology away from us. Your kids are going to need technology, and it's it's going to look like stone knives and bear skins by the time they're adults, right? What we have today.
I have a question to that. This is Dr. Schuckman, but I heard an analogy recently, and Katie, I'd love your thoughts on this. They were describing kind of right back in the day when Morse code was huge. They quickly implemented and were like, hey, every kid needs to learn Morse code, right?
Yeah.
Because this is our technology, right? This is a thing. So then they started aggressively teaching it, right? But then Morse code becomes outdated. Or you're mentioning this coding, like Fisher Price thing, right? But I, as an example, have recently written computer code using AI, having no idea how to code, right? Like I created a personal assistant for myself. So my fear in all of this is that by focusing a little bit heavy on the technology side, we're missing the chance to teach these kids how to learn. Because when my daughter creates PowerPoints on a presentation, she's more copying and pasting information.
Well,
But
let me push back.
do you think?
When you or I drive a car, unless you've got
Yeah.
you've got a mechanic's background, we don't need to know how that thing works under the hood.
No, correct.
Is that the same as coding?
Kind of, right? Like, do we
Yeah.
need to learn how to code?
Or
can
just
we just
tell a chatbot,
Yeah.
do this and code it for me?
Right. Because my thought is you have to be creative enough to come up with the idea to create in the chatbot to ask it the right question. And I'm nervous our kids are missing that.
Emily, weigh in here.
Well, I was just thinking, so another book that I recently have started reading is Digital Delusion by Jared Cooney
so
Horvath.
good.
And he says we have to learn the hard thing first before we can do the easy thing. So
Yes.
he is a neuroscientist and educator, and he can use AI to bring all of his statistic things together because he already knows how to do that the hard way. So, for example, the car illustration, it's probably good if we all learn how to drive a manual or a stick
Yep.
before we learn how to drive an automatic.
Right.
I bet we'd be better drivers.
I know how. I learned on a manual.
I learned on a manual too, but that doesn't mean I understand what's going on in the gears.
Nope, me either. Nope, same, for sure.
Okay, so let's get to the point where I don't know if there is how much disagreement. There are different viewpoints here. Let's find the common ground. Dr. Skogman, you said, there are kids with dyslexia or ADHD,
speech impediments, autism.
certain
Yes.
disabilities. For whom technology is essential, right? You didn't.
Yes, and so beneficial. So this is, again, probably what Katie's saying, right? It's not an either or. It's a yes and, right? So I think for so many children with learning disabilities, there are assistive technology devices, whether it's an iPad that they use that they can push buttons of pictures or different things that can speak for them that have been life-changing for them and these families.
Right.
And all day, every day, I want to see technology used for that. And even for your average learner, I don't know if you've heard of like Mark Rober. So he's this NASA engineer and astronaut that has created an insanely cool free online science curriculum that teaches. It has like these short videos and then like basic things that classroom teachers can use to get these kids very engaged in like blowing things up and sending it all over. And like, so that's a great example of like, yes, use what's available online. Like I've got my new AI bot, right, being my personal assistant and sending me some things every morning. So it's like, I'm not anti-technology, but I am, let's really protect the brain in this K-8, get them super creative, get the strong foundation, then aggressively teach them how to use technology as they get older.
Katie Nedwick, how would you describe how you see the optimal mix of technology and I'll just say old school learning that now that we've learned some lessons and sacrificed some young minds, I think, in the process of doing it, I think. Not intentionally, but this technology is just racing forward at an incredible speed. Where are we, Katie? Where do you think we should be?
I think somewhere probably in the middle. I think of where we maybe currently are. I think that, in my opinion, technology can be very helpful in the classroom, but it has to be used the right way. Like the example that they spoke earlier about, a whole classroom of kids on iPads with their headphones on, that's probably maybe not the best way to use it. I see it better with the engagement, right? I see it better as a collaborative effort between the teachers and the students and peer-to-peer as well. You can learn a lot from your peers. And so I think technology can be very beneficial in those ways. And also we're exploring using technology outside of just as a technology piece. So for example, I worked with a class this year and she wanted to talk about picture books. She wanted to match picture books and engaging in conversation with little kids, like preschool age, and our coding bots. And so our students had made a lesson plan designed around reading a book to the kid and having conversations with them, and then taking a piece of that and turning it into a coding activity that they could play to kind of reinforce what they are reading in the book. So I think things like that, very intentional uses of technology, I think could still
Dr.
be
Skogman,
beneficial.
are you on board with what, if you understand it? I think I understand it.
Katie's not going to like my response.
Yeah, give it.
No. All
don't
day,
like-
every day. I think every kid in America can wait to learn to code until they are a 10th grader. I think by trying to implement some of this technology. And again, Katie, I'm speaking more from like, this is my own kids' experience in their school. They go to an amazing school. They are overusing technology every single day. And I know that these teachers are trying to do the right thing. Absolutely. But it's not working.
Yeah, Katie, I'm sure you immerse yourself in a wide spectrum of beliefs and ideas and expertise about, Teach Studio, what you do there, Teach Studio. How do you figure out what the balance is?
That is a great question. I think that's still something that we're probably working through.
Day by day, week by week.
Yes.
We all are. We all are, right?
Yeah, exactly.
We all are.
As more things come out. And also, we're working with the education students, so we're not directly in classrooms with students.
But you're educating
I'm more
the
working
next
with the
educators.
college students.
Yeah.
Yes, yeah.
Right.
Right.
Yeah. So hopefully by the time they get into schools, schools might have a different guidelines or something like that about how they want to see it used. And I don't think that they should be on it all day, every day. I mean, I definitely think there's still a place for some of that other educational learning that they need to do, that students need to do.
Okay. I don't know where we are in classrooms, if there's any data out there about if there are a lot of classrooms in Iowa where they are doing the solo, I'm in a corner with my iPad thing that we may have been doing a few years ago. But I want to ask each of you this question, have your answer to each of it. Start with you, Emily. If a parent is listening right now and they want to push back constructively with their school or their child's teacher, what question should they be asking? What's a good approach?
I think first it's important to understand how tech is being used in their child's classroom, because for some it is only 20 minutes a day.
Don't assume. Make sure you have a grasp of what's going on.
Yes, exactly. Yeah, and have a good relationship with the teachers, and open communication, I think, is a big thing, because sometimes teachers are using technology in the classrooms because they are required to by the district.
Right.
Correct. That's often the case.
They don't just make up their own rules. Dr. Skogman, what would you say to that question?
I'd say
how should the pushback be if you have concerns?
Yeah.
Of course, inform yourself. Like Emily
inform
said.
yourself. I think collaborate with the teachers, right? I very much our teachers are doing the best job they can. They're working the hardest. Absolutely. I think forming, like Emily has actually, a coalition with other parents makes your voice a lot stronger. So I've spoken now at probably 6 different school board meetings, right, as a pediatrician expert on just asking the school boards to question a little bit of this.
Yeah.
You also, as a parent, now can request that your child not receive one-to-one devices. And I think engage in conversations with your kids, right? Most of what I've learned about tech have been having conversations with my kids. And then I asked actually my daughter to create a presentation for me at home on my computer so I could see how much active learning is happening in this. And then I was like, oh, this is really probably not working. So here we go, know. And then I asked for a couple different things. But I think just continuing the conversation, because nothing's going to change overnight. But the more empowered and aware you are, there's also a great website, edtech.law, I believe is what it is. And so that has some of the recent litigation and things that are changing as this is becoming more of a thing.
We're flying over a lot of topics here quickly, but to the point of if you're in a community, none of this has started, and you want to get the conversation going, why not send them the link to the podcast of this conversation?
Absolutely, yeah. And follow.
Tomorrow.
I'm on social. You can follow me. If I try to post as much as I can.
In 20 minutes or half an hour, you can get up to speed on what I've been brought up to speed in the last few minutes. Katie Nedwick, what do you think? How do you answer that question for parents listening right now? How to approach, push back, whatever you want to call it, a school, your child's teacher?
Yeah, I think what they're saying is great. I think having the collaboration with your teacher is really important, because truly I feel like the whole conversation with technology, it's a group effort, right? Parents need to be involved in their students' education, and there's a lot of pieces involved because it is the teachers, but it's also the school districts, and there's just a lot of parts in there. So I think what they said about having that conversation with the teachers, see where they're at, how much technology they're using, and then being able to have that relationship where you can go to the teacher and say, this is where I think I'm more comfortable with. Is there a way we can adjust that? I think is a great way to approach it.
Yeah, we started off this conversation with getting in a time machine going back to just a few years. Let's think ahead if we can, not just to the next school year, but further out, 5, 10 years, 20, and we don't have much time, so I'll ask you to be brief. Emily, 5 years from now, 2031. Yes, it will be 2030. Oh my gosh. Iowa's law has been in effect for 5 years in 2031. What does the average Iowa elementary school classroom look like? Has the pendulum swung back, or did the law just create some workarounds that we're going to get that technology in there anyway?
I sure hope the pendulum swung back a little bit. pencil, paper, manipulatives.
Absolutely. I hope there's more litigation for these profitable ed tech companies that are making all these promises that are not coming true. And I hope that teachers and parents are in alignment with each other, that like, hey, this is actually what's best for our kids.
Katie Nedwick, you get the last word.
I think that it's going to be in the middle. I think we're still going to have some technology, but I'm hoping it's more intentional and it's designed to do what we need the technology to do.
Okay. We'll all agree on that, won't we?
Yeah.
Yeah, why not?
Yeah.
That sounds good.
Yeah. We're all evolving. We're all learning. We're doing the best we can every day. Every parent in America is.
Absolutely.
Katie Nedwick of UNI, Dr. Paget Skogman, Cedar Rapids-based pediatrician, and Emily Hooley, a concerned parent that you'd probably like to have in your neighborhood, looking after the concerns that pop up in your school. I'll just say that. Emily, Dr. Skogman, and Katie, thank you very much for this conversation.
Thank you, Ben.
Thank you.
When we come back, we'll talk about the healthcare workforce shortage here in Iowa and solutions to it. It's River to River from IPR News. It's River to River from IPR News. I'm Ben Kiefer. Well, we know Iowa is a state where you can drive, I'd say an hour without passing a single stoplight. And in many of those same stretches, you can drive just as far without finding a doctor. Iowa ranks 44th in the nation for physicians per capita, and by one measure, dead last in the country in the measure of OBGYNs. Now, the Iowa Medical Society has spent the past 2 years building a roadmap to fix that, pushing landmark legislation through the State House, convening hospital executives and doctors under the banner of Operation Iowa, and now launching a new statewide job board to connect healthcare employers with workers who might never have known an Iowa opportunity existed. Dr. Joel Ryan is a family medicine physician and chief medical officer at Great River Health. That's a Southeast Iowa health system based in Burlington. Dr. Ryan is also board chair of the Iowa Medical Society. I spoke with him earlier today. Dr. Ryan, so good of you to join us.
Yeah, thank you. It's great to be here.
As mentioned, Iowa ranking 44th in the country for physicians per capita, and even worse, a dead last for OBGYNs. When you are living that reality as a chief medical officer and a practicing family doctor, what does that actually feel like on the ground?
Yeah, absolutely. It creates challenges every day. First as a physician, the way I feel it is I'm in primary care. So part of what I do is try to evaluate patients and determine if they need care by other specialists. If I'm not able to get them into a specialist in a timely manner, that can create big gaps in their health conditions. Things can get worse, that can delay care and create frustrations for everybody. From a chief medical officer side of it, I spend close to 50% of my time almost on recruiting, it feels like. We constantly have open positions here within our clinics and our hospitals, basically across all specialties, primary care included, as well as more of the advanced specialties like oncology, basic things that we want to be able to offer to the residents of Southeast Iowa. And so recruitment and trying to get people to come, doctors to come here to work for us or just in the state of Iowa is a big part of my job.
Right. And beyond physicians, this is a workforce crisis going all the way down to nurses, lab techs, surgical support, administrative staff, correct?
Absolutely right. Yeah, we've had nursing shortages throughout the state. Those have affected us here, drives up the cost of care as we have to find nurses to come and fill in open shifts from other areas. We've had difficulty, even with ultrasound techs coming in and making those services available on a 24-hour basis. It's hard to find radiology technicians to cover those night times. And so when patients come in the middle of the night to the ER and have a condition where they need some advanced imaging, it can be difficult for us to provide that.
Yeah. Give the shortage perspective from the patient experience, that perspective in Southeast Iowa, someone who may need to see a specialist to get a cancer care or have a baby. What does it look like from that perspective?
Yeah, well, you mentioned the statistics for obstetrics and gynecology specialists. It's not uncommon for us to have patients that drive 45 minutes to an hour to come here to receive prenatal care or have deliveries. And as you can imagine, when someone goes into labor or if they have an obstetrical emergency, that creates significant challenges for us to manage in our more rural hospitals. And unfortunately, sometimes can affect outcomes. For more clinic-based work, giving somebody from a primary care standpoint, finding a cancer diagnosis, patients and doctors want to get that patient in to be seen as quick as possible. And not having that referral access available immediately or within, 1 to 2 weeks can create, tension, anxiety, and also potentially make it a worse outcome for the patient as well. So we do see delays for specialties. It depends on the specialty. Some specialties, such as endocrinology, rheumatology, can be up to 6 to 12 months before you can get in to see a physician.
Okay, you've outlined the problem very well. Let's get to what's happening now and solutions, forward-looking. Operation Iowa. It's an acronym for Innovative Opportunities for Workforce Action, bringing together some 60 physicians, hospital executives, community leaders to tackle the problems. For someone who's not heard of Operation Iowa, what more do you want to tell us? Because we have completed phase 1 of that, right?
Yep. So the first meeting, this was organized by the Iowa Medical Society and we had the first meeting back in December of 2024. And I was present for that. It was really an exciting time. It wasn't just doctors. Iowa Medical Society represents all the physicians in the state of Iowa. But this included, healthcare executives, educators, like you mentioned, a wide variety of people that will have thoughts. And what we were looking for was solutions on how to address the physician shortage and just workforce shortage in general. So from there, we spent a day and a half. We tried to collect ideas and then kind of boil them down to a few that we could plan for and take action on. And we're very fortunate after that first phase to have some policy work that did end up going through and getting signed by Governor Reynolds a year ago. And that included monies to expand physician residency training programs, increase loan repayment amounts, and along with ways just to increase rural healthcare access for the state.
Yeah. I understand one of the core findings of Operation Iowa so far is that physicians tend to practice where they train, and Iowa just hasn't had enough residency slots to keep graduates in the state. How many slots are we talking about, and where will they be? Is this all centered around in the Iowa City, Coralville community?
Well, not necessarily. You're right. So Iowa has approximately 380 medical school graduates every year. Unfortunately, in the state, we only have about 275 first-year residency slots. And those residencies are not all at the University of Iowa in Iowa City. There's residency programs in Des Moines with hospital systems there. And we also have some rural-based primary care residencies throughout the state as well. But yes, absolutely right. That's one of the things that we found is that physicians tend to stay in the area where they complete their training. And so increasing those residency opportunities within the state of Iowa, that'll bring young doctors in, expose them to things that are going well in the state, and hopefully they'll stay here.
Mm-hmm. If you just joined us, Dr. Joel Ryan is a family medicine physician, chief medical officer at Great River Health, talking about Iowa's healthcare workforce shortage, what's driving it, what the state has done about it. And now let's dive into the Iowa Medical Society, of which you are the board chair, having just launched the Iowa Healthcare Job Board. Tell us, Dr. Ryan, what it does, who is it for, and what kinds of positions are on it?
Yep. So just earlier this month, we're really getting this going. And what we wanted to do and was address a need that we heard was that there's lots of jobs in the state of Iowa, obviously. According to some, I think the Iowa Workforce Development estimates about 1,000 job openings right now for physicians within the state. But it was hard to find those jobs. And so what we're trying to do is create a job board where anybody, any organization can post these positions, whether it's a small rural community private practice out there in rural Western Iowa, or one of the larger health systems. Independent groups welcome to join on this, and it's a free service for any group member of the Iowa Medical Society. There's a small fee for others, but very, very manageable. Mm-hmm. And by bringing this into one place, it'll make it easier for residents, doctors within the state, but also outside the state, to see what's available in Iowa. And like you mentioned, it's a workforce problem. So not just a physician job board, but also for nurses, therapies, other dietitians, those types of jobs that are needed within healthcare can be posted as well.
Yeah. And what specialties are you most urgently trying to fill right now?
All, honestly. Primary care is a big one right now in the state of Iowa. We, being so rural, we need primary care doctors throughout the state. So that's important for us. But also, like I mentioned, oncology, cardiology, nephrology, OB-GYN, of course, that's where we're actually the lowest, like you mentioned, lowest in the country amongst all the states. So really, this is a not just narrowed to one specialty. It's across the board from a healthcare aspect.
Dr. Ryan, IPR News reported that some medical students are factoring Iowa's abortion restrictions into their residency decisions. As someone who recruits OBGYNs into the state that already ranks last in that specialty, is that something you're seeing or hearing from candidates, that you have otherwise good prospects there, but then they factor into their thinking about coming to the state Iowa's abortion restrictions in their residency decision?
Well, we do hear about that. We hear about a number of things, honestly. And like you mentioned, creating an environment within the state where physicians want to stay in practice is important. And so that can be a factor. We're also looking at other ways that we can make the state more appealing, such as the legislation that was signed just last May by Governor Reynolds that improved prior authorization processes, making sure that prior authorizations are reviewed by physicians within the same specialty, also reducing some administrative burdens on licensure. So those are topics as well that we're trying to make sure that we're making it an appealing place to practice for all physicians.
Iowa's abortion restrictions may be a factor, you said, but can you recall, you don't have to recall in detail, but there are instances when candidates for residencies in OBGYN have just said flatly to you, or you've heard through others that they've talked to for interviews, I just can't do that with Iowa's laws in this area.
It is a concern, and I hear it, not just from candidates, but also from our own obstetricians here. And the concern is, a lot of it's from a liability standpoint. And what they're worried about is, we're cautious about having areas where doctor's care can be criminalized in a way. Mm-hmm. And so we're trying to work through that with our legal department and make sure that we can provide care in compliance and within the laws, of the state, but still allow our physicians the bandwidth to take care of patients in their clinics as they see best fit. Really, we would prefer that government doesn't get involved within that physician-patient relationship, and what happens in that clinic office is just within the patient and the doctor.
Mm-hmm. Medical school debt is in the six figures. That's a genuine deterrent. What's your message to a high school student in rural Iowa who's interested in medicine, but really worried about that cost, over $100,000 at least?
Yeah, well over 100,000. I think the average now is up to like 225,000. This is something else the Iowa Medical Society is working on with phase 2 of Operation Iowa. We're trying to reach out to the younger, the high school students, college students, or even elementary students, and let them know what it's like to be a doctor and what the process is. Just last month, I had the opportunity to go to one of our local high schools here with another of my colleagues and meet with a couple classes of high school students. And this came up as one of the first questions they asked is, how do you afford this? And so what's important, I think, is that we can explain the process and let them know that it is manageable. They just have questions because it's a big number. When you're a high school kid and you hear several $100,000, but we are working on loan repayment programs and things like that can help manage the debt load as well. So I think just having the discussions is important to help them understand what that means for them, their career, and give them some advice on managing that without it getting out of hand.
Doctor, I want to put this in a national context. The physician shortage countrywide is projected to, according to what I have, some 86,000 by 2036. That's a big shortage of doctors in the country. And Iowa is competing for this a shrinking national pool. How do you compete with states that have better rankings, bigger cities, and often higher salaries?
Yeah, it's a challenge. And that's a scary number when you think about that 10 years from now, especially with our aging healthcare population. And I think that's why we're trying to start looking at the younger students in the pipeline. And, Iowa's a great state, and kids that grow up here realize that we feel like if we can educate and keep people here for residency, then there's a great chance that they'll want to stay here and take care of the residents of Iowa. And that's what I did throughout my career. It's been very rewarding. And so I think that's, from an Operation Iowa standpoint, is really where we're trying to focus as our next phase.
Briefly, what kept you here?
The people, honestly. Simple enough. I just the people of Iowa. I just get along well, and I think everybody takes care of each other, and I love it here.
Yeah, I get that answer completely. I'm on board.
Yeah.
We have about a minute left or so. So if you look back, Dr. Ryan, on this work, let's say 5 years from now, 10 years from now, what would tell you it worked? What are the metrics you're watching?
Well, I think we're gonna need to look at how quickly patients can receive care, but also we're gonna need to look at things like cancer rates, our rates of OB complications, things like that, heart disease, diabetes, and I would like to see those rates declining, and I think that can happen as long as we're able to reach out and get to patients earlier in the course of their illnesses and have those safety net services available.
Yeah, and more policy changes from Iowa lawmakers?
That would help. Payment reform certainly would help create a better, environment to attract physicians here to the state of Iowa and relieve some pressure on us. So yeah, absolutely, the State House can help.
Dr. Joel Ryan is a family medicine physician, chief medical officer at Great River Health. That's in the southeast part of the state, based in Burlington. He's also board chair of the Iowa Medical Society. And it's been a delight to have you on to talk about what it's like on the ground and from a 30,000-foot view as well, Dr. Ryan. Take care.
Thank you.
Today's program produced by Danny Gear with help from Samantha McIntosh and Nev Kelly. Our executive producer is Catherine Perkins. I'm Ben Kiefer. Thanks for joining us.